Today we are going to start with the series of lectures on Organon of Medicine. Here some lectures I am taking here, not all the aphorisms, but the selected aphorisms I am going to take it here, and we will have discussion on those aphorisms. So my name is Dr. Shashikant Kammar, Associate Professor, Department of Forensic Medicine and Toxicology, Yenepoya Homeopathic Medical College and Hospital, Mangalore. So today we are going to start the first aphorism and the explanation of this aphorism. So each and every physician, that is homeopathic physician, is aware of this aphorism or this particular statement or the line. Why? Because without this, the physician is not the homeopathic physician. To be a homeopathic physician, he should be aware of this particular aphorism, which is the initiation of the homeopathic, or you can say organon. So here the first aphorism tells, the physician's high and only mission is to restore the sick to health, to cure, as it is termed. Friends, this aphorism, each and every word of this aphorism is very important. Right from the physician, the high and only mission, and restore to sick to health and cure, and it is as it is termed. So each word, each phrase is important here. What these particular words tells, what is the meaning of that? Basically, this is for the students who are there in the first YHMS. They are knowing all these things, and to more elaboratively, I am going to tell you people, this is the best aphorism to by heart. There are so many aphorisms are there in Organon of Medicine where we are supposed to by heart it. Okay, out of those, this is the one aphorism. So here, physician's mission. So what is the physician's mission? Or you can say these are the objectives which are there. This is a primary responsibility. The physician's primary responsibility is to see the patient as a whole, not the disease. Disease, obviously, disease is very important, but how this individual is responding to the disease, how this particular individual is presenting his illness, that that physician should understand. Okay, so then after understanding this particular disease in the patient, the physician is going to think how to restore this, whether the disease has to be considered as an acute or a chronic depending on presentation of these symptoms, and then how to deal with those acute and chronic diseases. This is his important point to understand here. Then once he understood what is there in the disease, then what is there in the medicines to be cured, so he has to match these two, medicine and the disease, and the cure, obviously the cure is going to take place. So what is the cure? Cure is nothing but the asymptomatic state of an individual. The person is not having any symptoms. In aphorism 8 he has told, if the symptoms are persisting, that means the individual is having some illness in his body. So without symptoms, if the person is there, that means he do not have any sort of the diseases. So these are the primary things, or you can say these are the objectives of the particular first lecture. Okay, fine. So now, so I am just telling here that the physician's high and only mission is to restore the sick to health, to cure, ad vitam. This is the aphorism, but each word I am going to tell you here. So here the first word is called a physician. Who is the physician? The person who is having the art of the healing, or is the person who is knowing what is the disease, how it is manifested, what are the signs, what are the symptoms, whether these signs and symptoms are the primary or the secondary, or it is disease induced or the medicinal induced. If he knows all these things, he are going to tackle that individual who is having the disease perfectly to get the cure. So that means it's an art. This is an art of healing. So the person who is having the art of healing, he is a physician. And at the same time, he should be a good counselor. Then he should be a good advisor, because what happens, the patient who are coming, the patient doesn't know what is to be done, what is not to be done during this particular illness. So he should advise there. He is a good advisor to the patient. It is not only to the patient, even the physician is the advisor to the people who are asymptomatic. That means what are the things which causes the disease, what are the things which are having the base factor of the disease, he is knowing. So he is going to advise to the other people, or you can say during counselor, as a counselor also he is going to tell all these things and advise to the people. Then he should know what are the auxiliary line of management. So all these 4 criteria, if the physician is knowing, if the person is knowing, he is called as a physician. Obviously the basic graduation should be there. Fine. So next, the next word is here is the high and only mission. Mission, we know what is the mission is there, so many missions are there, but out of this, this one thing, high and only mission of the physician is nothing but to take care of his patient as a whole. That is his mission. The most important, perhaps the only duty of the physician is focused on the patient's health. That means there is nothing important other than the patient. So whatever the patient has come to you and you are telling that I got some other work, I am to going there, after coming there I am going to take the deal with you, deal this patient. No, I am sorry, he is not a physician, because he is giving more importance to the other work than the patient. His primary importance should be given to the patient, then everything will be the secondary. So it is the mission of the physician to take care of the health of the patient, whoever comes to the physician. Next, here the next point is restore the sick to health. The mission is to restore the sick to health. Restoration of sick to health means however the disease has developed in the body, it has come back. It has come back to the normal stage. It is health. If I say health, health is into 2 categories. One, the physical health as well as the mental health. In homeopathy, we are considering the mind, first mind. From the mind only everything is coming out. In another word, it is told that the mind is the reflection of the health. So whatever that mind thinks, the body is going to reflect it exteriorly. If mind think that I am sick, the sickness will be expressed externally. So this is the condition where the mind should be taken into consideration whenever we are taking or we are dealing with the case. Okay. So once the person is deceased, once the person is having the disease, if the medicine has been given, so the cure has to take place in particular way. So that way is nothing but the Hering's law of cure. So what is Hering's law of cure? It states that the symptoms should disappear from within outwards. The symptoms should disappear from above downwards, from most important organ to the less important organ. And the last very important is the symptom should disappear in the reverse order of its appearance. So if all these criteria are fulfilled, then one can say that this is a restoration of the health has taken place. Everything should be in order. The symptoms which appear at the beginning should disappear at the last, and the symptom which had appeared at the last disappear at the beginning. So this is the order. If this order is maintained by your medicine, that particular condition is called maintaining the homeopathicity. If that homeopathicity is maintained, definitely we are going to get the ideal cure over here. So this is nothing but the restoration, illness back to the normal stage, that is restoration of the health. Okay. The next term is to cure, as it is termed. To cure. Cure is nothing but the asymptomatic state of the individual, as I said. So cure has to take place in proper order. Proper order according to Hering's law. The another word is nothing but it should be very gentle, without suffering. Or you can say if you give the medicine, patient tell that doctor, I am after taking your medications, I am getting such other symptoms. So this is not the cure. It may be the symptoms which appeared after administration of medicine, it may be the symptoms of the disease, or else it may be the symptoms which already it is existing in the body and it has not been told in his first sitting. Now that symptom is aggravated and the patient is not in a position to tolerate that, so he is coming and telling that this is the symptoms which I am observing over here. So this is nothing but the accessory symptoms. So now what is to be done with these accessory symptoms? Accessory symptoms should be considered if it is the disease accessory symptoms. If the symptom of the medicine, if it is coming at the accessory symptoms, should not be considered in his totality of the symptom. Why? Because the symptoms which is appeared after the administration by this medicine, that will disappear its own after particular time, whereas the symptoms which is coming out of the disease, it will not go its own, that has to be treated with the medicines. So once this is treated, definitely we are going to get a cure, rapid, gentle and permanent cure we are getting. So then only you can say yes, this is the cure. And there is one more point here, is nothing but the aggravations. Homeopathic aggravation should be there in acute condition. If we are observing any sort of the homeopathic aggravation, that is a guiding line or guiding thing to tell that yes, my medicine is acting on this individual. So aggravation in the sense, the aggravation should be very short, very quick and very strong. So that is homeopathic aggravation. It should not be very long lasting or after 1 day or 2 day aggravation. That is not homeopathic aggravation. It should be very short, strong and quick. Then only we can say this is the homeopathic aggravation. Once the patient is giving such type of the symptoms, we can say yes, my medicine is acting and there is no need of worry, medicine is taking care of the disease condition. So once this is appeared, this is nothing but the cure. The process is going towards the cure. Okay, its term is written that the term to cure specifically refer to the eliminating and treating the cause of disease in condition, thereby returning the patient to a normal state of the health. So coming back from the disease to the cure, that is the cure. Okay, so next point is as it is termed. Most of the students are not understanding this particular term called as it is termed. What does it mean as it is termed? It means as the cure is mentioned in the Organon of Medicine and basic principles of homeopathy. This is what I have written it here. But the thing is that wherever this cure is taking place in the body, so this particular term of the cure is explained in so many aphorisms in the Organon text. So as it is explained in the text, basically the second aphorism itself, what second aphorism tells, that is gentle, permanent cure of the disease. Gentle, it should be gentle, it is permanent. Okay, so that type if it is getting, that is a cure which is explained in the next aphorism. The cure has been explained in so many different aphorisms there in the Organon text. So it means that as it is the cure should, the restoration of health should be takes place to cure as it is termed in the different aphorisms of the Organon of Medicines. So this is the meaning of that, as it is termed means mentioned in anywhere in the textbook or anywhere in the aphorisms or the footnote. So we have to refer that also to understand this particular physician, this particular aphorisms. Okay. So this is about the first aphorisms, which I am telling that it should be by-hearted by each and every student of the homeopathy to understand what is the homeopathy physicians. Thank you very much for listening this. We will meet you in next lecture. Thank you.